nail surgery technique coming up with what would probably be most accurately called the Bose procedure. So this patient had had nail surgery done twice before, done very well by a local GP, but had regrown. And you'll see, I'll put a link up at the end. Done a few videos now on incisional nail procedures and where I use soft tissue and or phenol techniques in combination. This one is soft tissue Bose procedure without phenol. Check that we are, so no sharpness there, anything at the end, all nice and numb.
Yeah.
Cool, okay. Check we're still in shot, yes we're still in shot. We'll have it very slightly rotated out so that your toes in shot. Okay, so we do these under a little tourniquet, Sophie,
Yeah.
so there's no bleeding until we take the bandage off, and then there's a little. Okay, so.
That's an elastic band.
Well, yeah, we can go a little bit higher tech than this now. I mean, to be fair, these are. It's actually the most difficult part of the procedure, trying to get this on, particularly if your hands are wet. So, okay, get that out of the way. So what we're going to do, guys, it's really going to be kind of a hemi-VANDENBOS. You can see that Sophie's really got quite a lot of, well, I suppose a hypertrophic tissue. So you can do a nail surgery, and this was the one that was done previously, wasn't it, by GP? How many times was it done? Was it just
Twice.
Twice.
Yeah.
So it's been done twice by GP, and it's kind of regrown. So we've got the argument, and it's been phenalised in the past as well. It wasn't just that the GP took the nail off. So we've had regrowth again. The nail itself is really not too much the problem. I will actually, just for belt and braces, just take a little section of nail out. This is when Sophie was in a few days ago. I just kind of marked up where ideally you would do a PNA with phenol. So I am actually going to take a little bit of section of nail out. Now you can just do that hemi-VANDENBOS type procedure, and you can do it plus or minus nail. Various authors, having looked at all the literature, have tried it with and without. I think there's an argument in this case just to decompress the nail and take that out so that the nail itself is gone. So we've got these nice disposable weight snippers. When I say nice, perhaps that's not quite the right word. And then we're just going to rotate that section of nail out. So there's the nail. That's the causing the trouble. Let's regrow back. There's a little bit of skin. And then here now is our extra tissue. So you want to come back a little bit more proximally than perhaps you would think and really take out this section. So straight through. You notice I'm doing a little sawing motion, which is kind of acceptable with these. So there's our section there. So, as I say, really a little mini VANDENBOS. So to take all that section out. So the nail root is there, and that's just going to just close up, and it's just going to be away from that side of the nail. So Sophie, you'll probably find that little bit of nail will regrow. Mm-hmm. But the problem, really for you, was this tissue on the side. So it's quite a wound. In many ways, I think it heals quicker than you'd had the nail surgery before. When you'd had the phenol technique done by the GP before, how long did you find that had taken to heal? Because I'd normally say 4-6 weeks.
Yeah, I was okay to put some sort of shoes back on after a week and a half maybe. And I was okay to drive, but yeah, it took about 4 weeks-ish.
So this is like a big graze. So this is you can end up with a bit of a graze as well, but generally it's an easier wound.
Yeah.
Alrighty guys, so I'm just going to now just take that tourniquet off and just see how much claret we get. Second most difficult part of the procedure is getting these things off. look away. I might have to edit the video. I did a couple of these yesterday. It took me about 20 minutes to get one of these things off. So we just have a little look, and then we put on a wee bandage or bandage. You know what bandage is, Sophie?
No.
It's French for bandage.
Okay. I think probably I could guess at that one.
And then we put on, sometimes known as a Tom and Jerry dressing. Now you're too young to remember Tom and Jerry, but when I were a lad, Tom and Jerry, when he banged his toe, he had a big bandage go on his foot. This is now when I look and just check his shoes. So I spoke to Sophie last week and said make sure you're wearing some nice wide shoes, because these you can get a little bit of bleeding through. So we like to put a nice big bandage on just in case there's any leak through. Now, Sophie, actually, if you can put your finger there for me.
Yep.
Now, what time is it now? It's coming up to lunchtime. I'm just going to go for lunch. I'm going to be about half an hour. You okay there?
Yeah.
Oh,
Yeah.
I'll bring your sandwich back. And this is the following week. This is following taking down of the dressing, taking down of the non-adherent dressing. You can actually see I'd done both toes. It's just the left foot I'd done for the video, but I'd actually done the other foot directly afterwards. On what I would call a Bose procedure, BOSE 1971, somewhat of a fine line between a Bose and the true VANDENBOS. The true VANDENBOS and Bowers 1958 is more aggressive. But it's really from a thick to the thin end of the same wedge. So she'd had moderate post-op bleeding week 1, and then this is now 3 weeks post-op. So she's healed up really well because there's no phenol. The wound heals a lot quicker. This is a little bit of a pan away shot. This is 3 weeks post procedure, and you can see there's a bit of a scabbing, but it's all healed in and of itself. That lateral aspect of the nail will grow back, and there's still a bit of soft tissue swelling from the procedure, which will reduce and thin over the weeks and months. And as I come in just a little closer, this is after I've tidied up the scab, a bit more of an apical shot, and you can see that's healed really nicely. And again, just to point out, on that lateral aspect of the sulcus, some swelling from the cryptosis and also my surgical trauma that will reduce with time. So nice neat wound, heals quickly, soft tissue procedures without nail matrix resection. It's an option. Thanks for watching, guys.